Good afternoon, Springfield. Welcome back. We're here to get our update on our COVID 19. Today is October the 2nd, 2020, and we are here. So I hope everybody is preparing themselves to send in your questions and we will answer them. So let's get started. Let's just get right at it. Mr. Patterson, could you please give us a quick update on where we stand with the COVID 19?
Well, I'd be happy to do that, but first I'm going to introduce you as the president of the local NAACP chapter, President Denise Williams, our hostess for the show today. Thanks for being here.
Thank you for having me.
Bad week.
Yeah, it sounds like it. Boy, oh boy.
So we've had quite a few cases here. And so, recently we've been talking about how we want to get back down to that 45 to 55 cases that we had prior. We had been seeing cases in the 60s and 70s and 80s. This last week, so since last Friday to today, 130 new confirmed cases. So that's almost double the number of cases that we've been seeing. And because of that, I don't know if anybody saw the governor's new map that comes out on Thursdays. We're still orange, but we're orange with a crosshatch now because we meet the definition from the CDC of high incidence for the number of cases per 100,000 residents in the past 2 weeks. So that's problematic. That's really the highest weekly total that we've had in a very long time, probably since back during the Dole outbreak in June. It's been since we saw those kind of numbers. So we're up to 1,736 confirmed cases, 212 probable cases, and unfortunately, we've added a couple of more deaths this week. We've had of our citizens that we've lost from COVID-19. We're at 41 confirmed and 4 probable deaths, and that number probably will change. I'm fairly certain it will change again before next week with additions. So we really have some problems in the community this week, and those numbers begin to highlight that.
Okay. That's not good news for us, Springfield. I don't know what we're doing wrong, but let's keep our masks on. Let's keep it going. So let's start with the first question, Mr. Patterson. Clark County is home to several nursing homes. Can you tell us what is their status with the COVID-19?
So that's one of the things that's driving our current outbreak is the 130 cases per week is really coming predominantly from our long-term cares. And so we've been speaking with you in the past about the Northwood skilled nursing facility and rehab. They've been in outbreak status for a couple of weeks now. They currently have 25 active resident cases and 2 active staff cases. Forest Glen campus came onto our radar screen really hard this week with 43 active resident cases and 5 active staff cases. So, right there, when we start to add those up, we've got 75 cases of that 130 right there in 2 facilities.
Wow.
Fairly significant. And maybe not every single one of those cases at Northwood was counted in this week, but it's still an active case, which means it's when they're within their 10-day period, or it's within their isolation period because they're ill and those symptoms haven't gone away yet.
Yeah.
In addition to that, we have a new outbreak at Vancrest in New Carlisle. That's another 13 active resident cases and 5 active staff cases. Once again, you add those to our totals, and we're at about 90 cases just from long-term cares alone. So that is one where it's really driving our numbers forward. We're working closely with those nursing homes. We're trying to make sure that they have the right personal protective equipment, that their people are fit tested, and that we can slow these down rather quickly.
Okay. All right. Springfield, come on with your questions. I'm sure you have some questions for us out there. Let's continue on. How are the K through 12 schools doing with cases and quarantine?
Well, as we said a couple of weeks ago, the first couple of weeks, the first 3 weeks, things were a little calmer than we expected. We're starting to get cases here and cases there. So, as you're well aware, the middle school at Hayward was closed again this week for in-person classes. What happened there is they had a couple of cases, 3 total cases. Those cases were most of those cases were related outside of the school, but there was enough exposure in the school that the staff was exposed. And then in addition to that, at Laganda, we have one whole classroom. There was just one case, but because of the nature of that case, the whole classroom ended up being quarantined. So the rest of the school is fine. And hopefully most of those kids are going to be just fine as well. Then you might also have heard that the Kenton Ridge football game this week against Shawnee was postponed. That's because we have enough people who are quarantined that we just didn't have enough coaches to coach in the game and have the kids be safe. So unfortunately, now we have 3 total cases associated with the Kenton Ridge football team. We have at least one other case in the school, and we're monitoring that very closely with the contacts and the individuals who are then quarantined due to that as well. So we have a couple of other schools that have just a single case here, a single case there, or have a parent that's been involved, so, or a family member that's positive. So the kids then are quarantined and are out of school at this time. So on a weekly basis, we'll be updating those numbers to the State Department of Health. And on the coronavirus.ohio.gov website, you can see basically every county within the state and the school districts within those counties that have positive cases or quarantine cases between the students and the faculty. So,
okay. Well, let's take a question from Springfield. Candy is asking, with the nursing home getting bad again, are they not going to open now?
So I think Candy specifically might be referring to later on this month. The governor has said that they could have visitation begin.
Right.
And I would say that in almost all cases, if there's an outbreak situation going on, they're probably not going to open those nursing homes up for visitation. If things are quiet and they don't have active cases going on, means they're not testing every week because they have either a resident or a staff member that's positive. At that point, they're probably going to open for visitation on very specific terms, on very specific safety concerns going on. But in an outbreak status, I do not believe that they will be allowing folks to do visits. It's tenuous at best that we're moving forward with those visits, and I certainly understand with the mental health of the residents to make sure we could have their family members in person to see them. But in an outbreak status, that's not going to work.
Okay. Let's take a question from Catalina. She wants to know, with 90 cases coming from long-term care, where are the rest coming from?
Well, the rest are coming from community spread.
Community.
We have a case at Laganda. We have a case associated with Northwestern. We have a case not this week. I think it was last week. We had 2 cases associated with Clark Shawnee Schools and some at Kenton Ridge. So we're getting a smattering of those kind of cases. We're getting a smattering of folks from around the community. we don't really have any workplace outbreaks at this point. We did have one at Studebaker Nurseries the week before last. It looks like that one is taken care of at this point. And everybody's getting better. We haven't seen any new cases through that. So it's basically the ones and twos, the family members. We have a couple of families where like all four people in the family are ill, but we don't actually see contacts outside of them that are ill at this point. So those add up, those onesies and twosies add up pretty quickly across our community of our size.
Okay. Thank you, Catalina. So let's go to Stacy. She's asking, do you have a percent increase since school started?
We haven't specifically done that calculation. That's something we'll put on Kyle's plate to talk about for next week, maybe. So we've seen some, like I just said, we've seen some cases from the schools, but the vast majority of these, I mean, the 90 that we talked about, which were long-term cares, those were just the 3 long-term cares. I believe they've given me the stats on other long-term cares. So we have current resident cases. We have 1 additional current resident case, and we have and 4 other. So there's 5 others in long-term care related cases at other facilities where we don't have large outbreaks, just a case or 2. So that's 95 out of the 130 are directly long-term care related. So we'll look at a percent increase. I appreciate questions like that, and questions maybe to our Facebook account as well. If there are statistics that people want to see that we can do in a reasonable amount of time, and we can do with a reasonable what we call an N number. So a reasonable number so we can give you a valid result statistically. We'd be happy to spend a little time to do that, to answer people's questions.
Thank you, Stacy, for that question. Let's go to Janice. She's asking, why does the local hospital not have to test their staff for COVID-19?
So right now, that's not a recommendation to use the testing that we have available. It would only be to test them if they're symptomatic or they're in a position where they've been a contact with someone else. So that's the current recommendation from the CDC, is that they are tested when necessary, but not on a regular basis. We still have less testing capacity than we actually need. That has grown rapidly. Within the last 2 weeks, the regional COVID lab that's housed at Dayton Children's, they doubled their capacity. They're able to test up to 2,900 tests per day at that new facility. And even this weekend, they have more tests coming in than the 2,900 a day that they can run. So we don't want to get to the point where we're continually giving them more than they can run, because it takes too long to catch up. And then we get back to that 7, 8, 9 day turnaround instead of the 2-day turnaround, the 48-hour turnaround that we have at the laboratories now. So it's a good question, but that's basically what the recommendations are, that we don't use those all the time.
Yes, that was a good question. Let's take a look at Frank. He wants to know, the federal government is distributing rapid COVID testing very soon. Are these similar to the one that Governor DeWine had a false positive to?
Well, there is some similarity between the two. Yes, that similarity is that it is an antigen test. So there's 3 different tests that we talk about over time, and it's good for people to understand what that is. The gold standard is the PCR, right? It's the polymerase chain reaction test, where that's a great test to look at specific RNA and DNA and see if it's present.
Sure.
That's the one that most people get at this point. That's the gold standard. Though, either the the anterior nares, or the nasopharyngeal swab, the one that you really liked
Yes.
when you had that testing.
Yes.
That's the one that goes all the way in the back.
Yeah. I like that better.
That gets sent off. That gets sent off to the laboratory, and it takes about 3 to 4 hours to run that test. But then, of course, there's the transport to the laboratory. There's all the paperwork that has to go with it, and that's the one we get back in 24 to 48 hours. The second one is the antigen test, where we're testing for proteins on the surface of the viral particle. So remember, a virus is a protein coat over an RNA particle. So we're testing for the surface proteins, and those are the ones that you typically hear as rapid tests.
Okay.
We're testing. It takes about 15 minutes for that chemical reaction to happen, and then it's red. That's the kind that the governor got that was positive when he was going to be with the president, and then it turned negative when we did the PCR tests.
So which is recommended the best?
Well, the PCR is the best. So the one that goes to the lab and takes several hours to do that. The antigen tests are getting better. The ones that the federal government, that Frank's talking about, that the federal government's shipping out, Ohio is supposed to get up to 200,000 tests like that a week through the end of November. So those tests are better than the previous tests that came out, but they're still most effective when they're used, and when they were approved. The testing was done on symptomatic individuals, so it has a very good track record with symptomatic individuals. Now, what did we do when we tested the governor? When we did that screening for the governor, he was not symptomatic, and that is not a good use for the antigen tests.
Okay.
You will get false positives and false negatives when you don't use it in the clinical situation where it should be used. And so it will be very interesting, because initially when the Abbott ID Now came out, which is similar to the one that tested the president, they said the same thing, that it was supposed to be used with symptomatic people. There's going to be a much lower sensitivity and specificity on that test if it's not used appropriately with the right individuals. So these tests that the federal government is sending out should be used on symptomatic people. That will give us the best chance of getting good results.
Okay. Thank you for that question. Let's talk with Heather right now. How are the cases at Wittenberg?
Almost all of the cases at Wittenberg have now resolved. We do have a couple of cases, so just a handful. The last I saw, and don't quote me on this because it changes on a daily basis, last I saw, we had about 4 active cases, but that's down. Okay, so don't quote me on it because it's down to 2 active cases. Kyle just let me know. So 2 active cases at Wittenberg, and the faculty, staff have not been affected by that yet. It's been predominantly students, and in those cases, they're getting a handle on it. So we had that big burst of students, and it appears now the quarantine and isolation has worked, and we're getting that work down to just 2 active cases.
Okay, thank you for that. Well, let's see what Michael is asking. He's asking, or actually saying this. He said he heard that facilities are forcing staff to work in COVID units. Can those employees refuse to work without losing their jobs?
Well, actually, Michael, that's a good question, but that sounds like a question for some human resources attorneys, which I'm not. It all depends on the contract they have, or it all depends on their job description. If their job description says they have to take care of patients, then it probably does not differentiate between COVID positive patients and patients with any other communicable disease. So the important thing is to make sure that those individuals have the proper training and the proper personal protective equipment to make sure that they can be protected. And one of the things that's been very helpful in the long-term care facilities is when they're doing doffing and donning audits. So basically on every shift, they go in and make sure that people are putting on the gear right. They're taking off the protective gear right. They know how to do that, when to do it, when to wear it, when they don't have to wear it, etc. That's been very effective when we put those doffing and donnings and audits in place, and then retraining as necessary if we find someone isn't doing that correctly. So,
all right, very good. Patricia is asking, has a decision been made about Beggars Night?
I believe the answer is yes.
Yes.
We'd have to look at the sheriff's website, but I'm fairly certain that Sheriff Burchett has said that we are going to have Beggars Night this year. Has set a date for that, and we will have that. We just want to make sure there's some great guidance out by the Ohio Department of Health on the coronavirus.ohio.gov website, which talks about exactly how to handle those issues that we have in potentially going up to people's houses, limiting so that the people aren't reaching into a bowl, that the people are actually passing the candy out, that they limit the amount of time, that they stay as far away as possible. Some great things in there for people to do to make sure that we can keep our kids safe.
Okay. All right, Springfield, you having some great questions. Let's keep it going. We still have some time. I'm trying to search my phone because they're having testing here. Did you hear about that? I think it's at Hampton Church. I'm gonna try to find it before we get off of here, so I can mention that because I got the notification the other day. But we
Well,
do. Go ahead.
If you want to look for that, I will address something else that we really want to talk with our viewers today about.
Let's do that.
So, so we've had at least 2 complaints this week alone. About one was on Portage Path and the other was on Rosewood, where people are going up to somebody's door, knocking on the door, and they have the white plastic bags that we passed out with the masks and the information. And they're saying that they're from the health department and they're either asking for a donation at that time or they say that they'll be back a following day to ask for a donation. I want to assure the public that the health district staff, volunteers, other people working with us, our contractors, they are not going door to door asking for donations. We have in the past, and I'm sure we will again, distribute face masks, distribute information to people. But when we do that, we will never be asking for money. That is not something we will do. When our contact tracers, if you happen to get a call from a contact tracer, they might ask you a lot of questions, but they will never ask for financial information and they will not ask for money. So I want all of our citizens to be aware that we're not soliciting donations. We're not soliciting money in any way, shape, or form. We do not sell masks. We won't sell masks. We will distribute those masks to people at no charge. And that people, if someone offers you a mask and asks for a donation, that is no way related to the health department. And I'm not saying that we don't accept donations, but we're not asking for them. And we don't want you to hand them to anybody who is our employee or who isn't our employee. Keep those donations for yourself. People really need to have the money in their pocket right now to buy masks and to buy hand sanitizer and to make up for the economic impact of COVID. So I can't stress it enough. We won't ask for financial information. We won't ask for donations.
Good thing. I was just going to ask about that. There is going to be a COVID testing and results can come back within 48 to 72 hours. And it's no cost at all. The date is October the 17th, 9 a.m. to 4 p.m. at Northampton Community Church, which is located at 110 Community Drive. I've never heard of that. You?
Yes, that's a church we're well aware of in Northampton, right out. So that Community Drive runs right off of State Route 41 in Northampton.
Okay. And the contact is Keith E. Justice Phone number 614-402-0956. And let me repeat that number. Keith Justice, area code 614-402-0956. No more questions? Springfield? Well, I guess we're done. Did you have anything else to add?
Well, I think you said it earlier, President Williams, when you said, Springfield, wear your masks. Hey, the governor said it this week. He doesn't like to wear a mask all the time either, but we're just having to do it, and we're probably going to have to do it for the next 3 months of 2020.
Yeah.
We may be having to do it for 3 to 6 more months next year.
Wow.
It all depends on how fast we get the vaccine, how effective it is, how quickly it can be manufactured and get out there. But I think that's the one thing that's going to get us over the hump. I don't know if people saw this week that the studies that were done of the antibodies, that only about 1% of the people in Ohio it's predicted that 1 to 1.5% of the people in Ohio have had it. That could be as high as 10% of the population have had it, and we just don't know it. That was a very small sample back in June and July. So even if 10% have had it, that means 9 out of 10 people have not been exposed to COVID-19, and they're still at risk. We're going to have to slow the spread with the masks for a while yet. So I know that's not what everybody wants to hear. I'd love to come on here sometime and actually tell people what they want to hear.
I know.
But with this fantastic number of cases that we have this week, it just shows us that there's a lot of community spread. There's a lot of things out there. And unfortunately, all these folks that work in the long-term cares, they go back out into the community, so they get it and pull it in. And then sometimes before we know they're positive, they might spread it outside again. So we still have to be careful. We still have to limit our contacts, limit our travel to other people's homes and other places. But when we have to do those things, we just need to do them with care, with masking, and with concern about others.
Okay. I know it's uncomfortable, Springfield, to continue to wear these masks. I get it, but we need to keep each other safe and our families. So please, let's increase the mask wearing, because I still see folks without them. So let's come together, Springfield. We are all family. We in this together. So let's protect yourselves and one another. That's going to be it for us today. And we'll see you again in a couple of weeks. I want you to stay safe, stay prayed up, and stay kind. Have a blessed day, Springfield. Thank you, Mr. Patterson.
Thank you.